Hi, my name is Kasey Boykin. I am the clinical liaison for New Century Hospice. I am also the medication nurse for Always Best Care, and I'm here today to tell you a little bit about New Century Hospice. Hospice focuses on the quality of life for people, for patients and their caregivers who are experiencing a life-limiting illness so that they may live their life fully and as comfortable as possible. Our mission at New Century Hospice is to provide compassionate care and extraordinary service to patients and their families during their journey. A couple of myths and facts about hospice. Number one, hospice is not a place. So we take care of our patients where they call home, whether that's in their home, in an assisted living facility, a long-term care facility, a group home, wherever the patient lives, that's where we take care of them. Hospice is appropriate for any patient or client who may have a life expectancy of 6 months or less. Another myth is that hospice is expensive. Hospice is actually covered 100% by Medicare and Medicaid. It's also covered 100% by most commercial insurances. Another myth of hospice is that the patient has to be homebound, or what we call bedbound, and that is not accurate at all. Many of our patients still travel, they go visit their families, they go to the grocery store, so your clients do not have to be bedbound in order to be on hospice. Hospice also covers 100% of any DME equipment, so that's going to include a hospital bed, a bedside commode, oxygen. So if your client's already on oxygen and then they become a hospice patient, they no longer have to pay the rental fees for their oxygen. Hospice actually covers that. Their medications are covered 100% based on the diagnosis that they're admitted for. There are some stipulations, but traditionally their medications are covered 100%. With the hospice benefit, in addition to Claire and Paula, they would have an additional social worker from New Century Hospice. They would also have a chaplain, a bereavement coordinator that follows them up to 13 months after the client has passed. So they go through their first Christmas, their first birthday, for all their first holidays with the family, so that they can continue to grieve appropriately. The hospice benefit also covers a volunteer to be with them, along with the nurse and the aide that are going to come. Typically the nurse comes once to twice a week and the aide comes at least 3 times a week. They can come more if need be, if the family requests it. So who might need hospice? If any of your clients have significant weight loss, any reoccurring infections, frequent hospitalizations, if you have a client that's back and forth from the hospital, if a client is no longer seeking aggressive treatment, meaning if we have a cancer patient and they say, you know what, I don't want any more chemo radiation, they are absolutely qualified for hospice. If they have an overall health decline or increasing needs with their activities of daily living. Some of the hospice diagnosis might include Alzheimer's or dementia, stroke, Parkinson's, muscular dystrophy, any cardiac or pulmonary disease, liver or renal failure, kidney failure disease, AIDS, HIV, Lou Gehrig's disease. These are not all the hospice diagnoses, but those are some of the most common ones we see. So if you have someone in mind and they don't have these diagnoses, that doesn't mean they don't necessarily qualify. An earlier admission to hospice is encouraged to avoid crisis. We don't want clients or patients to be in a state of pain or crisis, so earlier admission is best. It allows also for the patients and families and you as the caregiver to build a relationship with the nurse and the additional CNA that's coming in the home and the chaplains, and it improves overall care for the body, mind, and spirit. So who can make a referral? You. Anybody can make a referral to hospice. If you have someone that you think needs care, You can call me at any time. Again, my name is Kasey. My telephone number is 225-236-7995. Or you can call the Always Best Care office and speak with Paula or Claire and let them know that you have a client or maybe a family member who you need Kasey to come out and do an evaluation on. Again, if you have any questions, please feel free to call me, Claire or Paula. And I hope to see you all soon. Happy holidays.